Welcome to the Hospital Association of Southern California's podcast series titled In the Spotlight. I am your host, Terry Hollingsworth, Vice President of HR and Education Services. And today we're talking about the importance of training to ensure that healthcare providers recognize human trafficking in patients and are equipped with resources to connect them with the much needed support and services. Our guest speaker today is Samantha Calvin with the Human Trafficking Awareness Program at the Arizona State University Edson School of Nursing. Samantha is an anti-trafficking advocate and leader in Arizona and the United States. Samantha has used education and training to debunk the myths around human trafficking. In what ways might those who are experiencing or have experienced human trafficking present in healthcare settings, and how can these signs be subtle or easily overlooked by the healthcare system?
So the research shows that people who are experiencing human trafficking exploitation will present in healthcare settings, and most notably those are the ER or the urgent care, though they can also present in other settings such as primary care and other places too, such as like dental offices. Detecting signs is challenging, as human trafficking often imitates other related problems, such as maybe child abuse, domestic violence, and because of the subtle differences, human trafficking is often prone to oversight by the healthcare system and providers.
Although human trafficking is more often discussed and acknowledged in today's society, and many might have even attended Human Trafficking 101 courses in the past, why is it important for healthcare workers to continue to expand on this training?
Well, a basic understanding from a human trafficking, say like a 101 course, is beneficial. It's really merely just a starting point. Online trainings can often be hurried or outdated. We've all had the workplace trainings that we just click through to finish it. Continuing education, especially on this topic, is really crucial for all healthcare workers or those who intersect in the healthcare system in some way. And that includes people who connect with the healthcare system, such as maybe social work, nonprofits, law enforcement. And this in-person training will provide interactive learning, peer engagement, case study exploration, and exposure to current examples that online modules might lack.
Why do you believe human trafficking is a healthcare issue?
Human trafficking is a healthcare issue for so many reasons. Healthcare providers are one of the only professions that those facing current exploitation might see. In addition, there are long and short-term health consequences that victims and survivors will often face. And as you can imagine, these health issues span physical, mental, and social domains.
What specific healthcare challenges do victims of human trafficking face, and how does this impact their overall well-being and ability to seek assistance?
There can often be a lot of challenges for victims when it comes to accessing services. First of all, victims of human trafficking encounter distinct healthcare challenges that encompass immediate and long-term issues, as well as physical injuries to things such as PTSD or other complex mental health challenges. Also, the nature of human trafficking, which involves a third party, which is usually their trafficker and abuser, that impedes victims' ability to seek assistance because there's fear, coercion, and oftentimes a lack of trust in authorities, which all create barriers to accessing health care and support services.
Human trafficking is a public health issue that demands the attention of healthcare teams everywhere. I would like to thank our speaker, Samantha Calvin, with the Arizona State University Edson School of Nursing, and thank you for listening to this episode.